Hello, my name is Laura Scott. Welcome to our chemotherapy unit. Come with me and I'll give you a quick tour of our unit. This is our phlebotomy area. If you need your bloods taken or you need to speak to one of the nurses, we take you into this area here. We have 2 waiting rooms, both of which have tea and coffee facilities for you to help yourself. And this is the other side of our ward, and this is where you would come if you are having chemotherapy intravenously or if you need to come up and visit us through the helpline. Over to the right, we have one of our treatment bays. This is where you go if you need your chemotherapy intravenously. And I'll take you down to our triage bay. You would come up to visit us in the triage bay if you're feeling not well whilst on your chemotherapy. We have 2 nurses and a doctor that will look after you while you're here.
My name is Angela Berry and I'm a nurse at the Ulster Hospital Chemotherapy Unit. I will be one of the nurses looking after you whilst you receive your chemotherapy. Let me tell you a little bit about chemotherapy. It is important for you to tell the staff in the chemotherapy unit about the medicines you are already taking, including vitamins and herbal medicines, as they might have an influence on the chemotherapy treatment that you require. Typically, a member of the pharmacy team will discuss these details with you. Some chemotherapy treatments can be given at home and might involve taking tablets or capsules. Most chemotherapy is given as an outpatient in the chemotherapy unit, but some treatments need to be given on a ward. Chemotherapy is usually given as a series of cycles of treatment. In the unit, your treatment may be given as an oral medicine or an infusion into your vein or injection under your skin.
I'm Katrina Gallio. I'm one of the staff nurses here in this unit. When you come into the chemotherapy unit to receive your treatment, the first thing you will see is a room with comfortable reclining chairs. Everyone will be in their own clothes and you'll be able to relax and eat and drink while you're having treatment. So what should you expect? On the day you come up into the unit, your blood test is usually done the day before in your GP surgery. Or if you have a PEC line, the district nurse will do it the day before as well. You come in with the assessment with the nurse, and then you will see the doctor for consultation, and at some visits, there's discussions with the pharmacist.
My name is Brian McCauley. I'm one of the pharmacists, and I would like to give you some information about how we prepare your treatment. On each visit, you will be seen by a doctor, a nurse or a pharmacist prescriber to ensure that you're feeling well and that your blood counts are at the required levels. Once this has been agreed, your chemotherapy will be prescribed and a pharmacist will double check the details before the pharmacy team can prepare the drug which is specific for you. At the first appointment for treatment, many patients will have the chemotherapy pre-prepared, and this is because your bloods will not yet have been exposed to chemotherapy. From that point, your chemotherapy cannot be prepared in advance because, as stated, you first need to be seen by a prescriber to have the treatment approved. Chemotherapy preparation can take different lengths of time depending on the type of drug. Treatments given by infusion or injection generally need to be custom made in the aseptics unit, which is a special purpose facility within the hospital. Due to the nature of the treatment, there are processes and systems for checking that everything is appropriate, correct, and free from contamination before it is administered. This is necessary because the treatment will be given through the skin and will bypass most of your body's defense systems, and therefore it needs to be made in a sterile fashion. However, this means that it can take up to 3 hours for the chemotherapy to be prepared and delivered to the treatment area. Patients requiring purely oral chemotherapy will have an anticipated waiting time of up to 1 hour after the prescriber has generated the prescription and it has been checked by pharmacy. A prescription for medicine other than chemotherapy will usually be dispensed within 30 minutes, but occasionally the prescription will need to be supplied through the main pharmacy, and in these cases it will take a longer time for the medicine to be ready.
I've been coming to the chemotherapy unit for 6.5 years, and I remember my first visit very well. I was extremely anxious and didn't know what to expect, and that's okay, because when you come up here the staff are very, very friendly. Your fellow patients are always very, very friendly too, and if you have any concerns you can always stop somebody and they will take time to chat to you. They'll take time to address whatever you think is going to happen, or talk you through what is going to happen and not going to happen, and then you will come up, you will be assessed, you'll have your blood pressure taken and you'll have your weight taken, and then you will sit in the waiting room and chat to other patients and have a wee cup of tea. There's lovely tea and buns, and then you'll go and see a doctor, and the doctors are all wonderful too, and they will take their time with you as well and talk you through everything. And I have to say, everybody goes out of their way to make sure that people coming in for the first time who are anxious have the best experience possible. Yes, do wear loose clothing, because if you're getting anything intravenous, not in your arm, or if you have a port or a Hickman or something, they do need access to your chest area. And also dressed cool, because it can be quite warm, and just be comfortable. And I would bring something that you would normally do to sort of help you pass the time and ease anxiety, if you're into crosswords or knitting, or bringing a book. But generally there is a lot of chat and a lot of banter too. But I mean, some people, sometimes you're in the mood for that, sometimes you're not. But certainly, you know, and also you can go for a little dander as well if you want to. So wear comfortable shoes too. But yeah, in general, it's you know, it's a scary. The thought of coming to have chemotherapy is scary, but once you get here, you realise it's really not. It's really not what you think.
Chemotherapy is normally given as a number of cycles of treatment, which is dependent on the type of cancer you have and the chemotherapy regime that is best suited to treat your cancer. Your chemotherapy will be given at regular intervals, typically weekly or every 2 or 3 weeks, to allow your body time to recover between treatments. When you're receiving chemotherapy, you wouldn't normally feel anything at all. However, if you do feel unwell during treatment, it is important that you tell your chemotherapy nurse straight away. It's natural to feel anxious about some of the possible side effects of treatment. Everybody reacts differently, and it is unlikely that you're going to experience all the side effects.
Hello, my name's Rebecca Rainey, one of the doctors in the unit here. Let me tell you a bit about some of the common side effects of chemotherapy. You might experience some of the following: nausea and vomiting, diarrhea or constipation, sore mouth, numb fingers and toes, hair loss, infertility, urinary symptoms, or infection.
The most common ones are feeling very tired after treatment or feeling sick, but there are plenty of things we can do to help you with that, so it's important to let us know if you're experiencing any side effects. So how can we help you if you feel sick? Your doctor will prescribe anti-sickness drugs. These can be given via injection or tablets before your chemotherapy. You will also receive tablets to take home afterwards. It is important to take these anti-sickness medicines rather than wait for symptoms to develop.
Hi, I'm Natasha. I'm the wig specialist that comes on the Macmillan unit on a Tuesday. One of the patients' concerns are that they'll have a side effect of hair loss with their chemotherapy. Not all chemotherapy gives hair loss, but if it does, I'm here to help. So we provide a wig service. Anything you need, I'm here. If you want to book an appointment, I can come in for a consultation. I'll try on of wigs, headscarves, Aftercare Advice, and I'll be here.
I want to talk to you about neutropenia. White blood cells are part of the immune system. Main white blood cells which fight bacteria are called neutrophils. When they are low, you are neutropenic. When you are receiving chemotherapy, your body is more susceptible to infection because the drugs affect your white blood cells, which are part of your immune system. So what can you do to avoid infection? Act quickly. Contact us on the 24-hour helpline. Check your temperature. Good hand washing and avoid contact with infection if possible. The staff will give you a chemotherapy card which has the telephone number that you must ring if you feel unwell when you're on chemotherapy and for up to 6 weeks after you finish your last treatment. It is very important that you use the chemotherapy helpline if you're feeling unwell. This will allow you to receive prompt treatment. Remember, as soon as you feel unwell, contact us first.
Dealing with cancer can be challenging for you and for those close to you. It can be an overwhelming and confusing time, but help is available. The Macmillan Health and Wellbeing Service is here to help you live well, to answer any of your questions or put you in touch with someone who can, and make you aware of the range of supports and services that are here to help you and your family. Whilst we know that no two people are the same, some of the areas we help with more commonly are in relation to work, finances, talking to children, dealing with your emotions, local supports available such as complementary therapies, managing the effects of cancer such as fatigue, building your strength and stamina, understanding the roles of your healthcare team and the information that you've been given. Receiving the right information and support can make a real difference to how you and your loved ones manage. Our trained staff are here to support you or anyone affected by your diagnosis whenever you may need help. We're based at the Ulster Hospital and will listen to your worries and concerns within a comfortable, relaxed and confidential environment. Phone 028 90 553 246 to find out how we can help, or call over at our information centre where you can find out about the supports and services available, or also help yourself to the range of free information that lets you know about all aspects of living with or after cancer.